All right, the fight against the coronavirus continues here in California. State leaders work to distribute the vaccine. And with the new administration in the White House taking over the national pandemic response, what can we expect? Joining us live, Paul Seegert, the managing partner of healthcare consulting firm PCS Advisers. Paul, good morning.
Good morning. Thanks for having me.
Thanks for being here. So let's also talk about vaccine distribution here. What do you think the Biden administration can do to improve this and get this out to people quicker?
Well, it's been previously what we were doing was relying on an existing network of jurisdictional centers around the country. There's 64 of those, one for every state, some large metro areas and territories and so on. So what the Trump administration was doing was focusing with their Operation Warp Speed on getting the vaccines to market and then using that existing network to distribute them and allowing those jurisdictional areas to manage that themselves. And the results, of course, haven't been as good as we hoped.
Spotty. So when we talk about those, what can be improved, should states, I know the Biden administration has a big plan here, but should states, we've talked about New York going and trying to get vaccines on their own. Should they start doing this? Do states kind of fend for themselves?
I think that'll add to the confusion. In fact, with that state in particular, they're sitting on vaccines. They've been distributed more than they have administered, 40 or 50% more. And that's true for lots of states out there. The very best states, North Dakota, West Virginia, Connecticut, are maybe at 70 or 80% of what they received, they've been able to administer. So most every state has vaccine on hand that they have not gotten in people's arms. So I don't think that's necessarily the right way to go.
So instead of trying to get more vaccines, we need to focus on getting those vaccines that we have into the arms of the citizens in those states. That seems to be more appropriate.
Exactly. And what Biden's proposing is to handle it more from a federal level, prop up thousands of centers around the country, 100 in his first month, and vaccinate 100 million people in the first 100 days. And while the supply chain could support that, it would be a major accomplishment, a major feat to be able to put that into play.
Paul, thank you so much for your insight. It's nice to hear how we can make this a little bit better. Paul Seegert, managing partner for PCS Advisers out of Chico this morning. Thanks for joining us.
Thank you.